June 15th, 2026 work session. Welcome, everyone. I'm going to call the meeting to order and open it up to public comment on all items. This is your time to comment on any matter on the agenda or non-agenda items, but they must fall within the scope of the Billings City Council. And remember, you can only speak once for each item during the meeting. And then as a note, I'd like to say that City Council cannot take any action on any item of significant interest to the public that does not appear on the agenda. So your comments will be limited to 3 minutes. If there's any public comment, please come up, tell us your name, where you live, and take your 3 minutes. Last call for public comment. Seeing none, we'll close that part and move on to agenda item 1.
Mayor, if you're ready, I think Elise is going to take this one.
Come to the podium.
There we go. Is that better? Perfect. All right. I'm going to go ahead and share my screen here. Alrighty, that should be popping up here. There we go. Okay. Well, thank you, Mayor and Council, for having me here tonight. I'm here to share with you some information about our 21st Street Underpass study that we've been working on for about the last year and a half. The study was funded through our Metropolitan Planning Organization, or MPO. That's a federally mandated organization for urbanized areas over 50,000 people. It brings transportation planning dollars to our community, as well as some construction dollars for transportation projects. I wanted to mention our great consultant team. Our prime consultant was Kittleson and Associates. We have John Ringert on the line, who's here to help me answer questions should they come up, and was the project manager for this project. And then their subconsultant was HDR. They had a lot of great connections with the railroad and also helped out with kind of some of the structural review and things like that. All right, so a little bit of the history of the 21st Street Underpass study. This study was identified in our federal fiscal year 2025 Unified Planning Work Program, or UPWP. And I also just want to apologize that there's so many acronyms. I will try to explain them as I go through, but if there's anything you don't know, feel free to comment. So the Unified Planning Work Program is a document that the MPO, the Metropolitan Planning Organization, completes every year. It says, hey, this is what we're going to work on, and this is how much we expect to plan, or how much we expect to spend on these documents. So an important part of the UPWP is that it goes through our transportation planning process. So it did come to the planning board, the council, the county commissioners, and then was ultimately approved by the Policy Coordinating Committee, or PCC. And the reason why we included this study in that document is because at that point, 21st Street was listed as a project in the city's CIP. It was a priority for previous councils, and so the MPO stepped in to help look at the feasibility, see what's possible, how much is it going to cost, and also what does the public think about it. And then I just wanted to mention that I'm coming to you today as part of the MPO's transportation planning approval process. This process spans about 7 meetings, and I'll discuss it more later, but basically at your next regular meeting, we will be asking for a recommendation on the study to the Policy Coordinating Committee, which is the final step in the process. I wanted to mention some of our great team members on the Project Advisory Committee. I want to give a big thanks to Councilmember Neese. He spent a lot of time with us, and I feel like really gave us some great ideas and helped us refine the document. So we're really appreciative of his help. We also worked with the City Public Works Department, County Public Works, Met Transit, MDT, which is the Montana Department of Transportation, the Bike Ped Advisory Committee, some local businesses in the area, as well as the TIF districts in the area. All right, so jumping right into the study overview. So the purpose of this study was to identify strategies to enhance safety, improve multimodal accessibility, and improve roadway conditions. And there are a couple things I want to mention here. One being a large portion of this was the safety in terms of getting emergency services to the south side from the north side of Billings, where obviously our hospitals are located, and kind of looking at, would this help speed up potentially getting, life-saving support to somebody? And then also in the case of if something were to happen at 27th and that crossing were blocked, what's the most efficient way to get to the south side? I also wanted to mention here, we're going to get into the alternatives a little bit later. There are 4 alternatives listed as part of this study. And I'll just give you a little sneak peek right now. The first one is do nothing, so leave the underpass how it is. And I just want to mention that because I want to say that as part of forwarding a recommendation of plan approval to the policy coordinating committee, you're not committing the city to doing any one action. We're not asking you to commit right now to a large project. We're just saying, hey, this is information, these are resources that are available to you. It helps set you up really well should the perfect funding source come along in the form of grants or some other sort of funding, or maybe at some point BNSF has to redo the underpass and then we have information that we can provide to them. Or maybe the council would decide to, at a later date, to construct one of these alternatives. But just wanted to emphasize that by forwarding a recommendation of approval, you are not saying that you're definitely going to construct any one of these. All right, so the study area we focused on was obviously 21st Street, and then we also considered the potential for shifting of traffic from the 27th Street at grade crossing. Diving into the project process, so we had 4 PAC or Project Advisory Committee meetings, and then we had 2 rounds of public involvement. This involves sharing information out to the public and getting information back from the public in the form of surveys. And then we also coordinated with police, fire, EMS, and transit providers. As I mentioned, an initial reason for doing this study was that kind of safety piece of getting emergency services to the south side, so we definitely wanted to coordinate with them on what their needs were. We also worked with BNSF, the railroad. They do own this underpass, so they would have to be involved in anything that went on there. Looking at existing conditions, probably a big surprise for everyone is that the clearance is 8 feet. Just kidding. That's obviously something that I think most of us are well aware of. So we've got kind of low clearance there. The vehicle volumes are less than 1,000 vehicles per day. For EMS, transit, and fire, right now fire cannot use it, as neither can EMS or transit. Fire needs 13.5 feet of clearance. EMS needs 10 feet of clearance for use. Looking at the crash history, there's approximately 4 crashes per year. That may not sound like a lot, but given the low vehicle usage, it's actually a much higher rate than there is at 27th. So something interesting to consider. Many of the crashes involve the bridge elements, and about 85% of the crashes are property damage only. Also in terms of pedestrian and bicycle facilities, so there's kind of narrow, dark, and debris-prone sidewalks, and a lack of bicycle facilities there. So looking at the existing structure, our consultants determined that you could only lower the roadway about 3 to 4 feet with the existing structure. And with the existing structure, widening the sidewalks is somewhat limited under there. For the roadway, the vertical curve lengths are shorter than recommended, which limits sight distance, especially at night. And then grades at pedestrian crossings are greater than recommended. Another thing that's probably not a surprise to anybody is that we are very close to the existing groundwater level. I think everybody knows that that floods from time to time. And so if you were to lower the roadway, you would probably have to install a pumping system to keep up with that groundwater and stormwater. So looking at the public involvement, so We had 2 rounds of public outreach. The first round happened about this time last year. We gathered about 446 responses, and we asked about feedback on the current use, perceived challenges, and if there would be potential behavior changes with any improvements. One of the questions we asked during this round is, what's your priority in terms of what needs to be improved in the underpass? I think another unsurprising thing was that first people wanted the clearance levels to be improved, and then the second most important to them was drainage. The second round of public outreach happened in the winter of this year. We had 429 respondents, and we gathered feedback on the alternatives, and I'll get more into that a little bit later. So alternatives evaluation. All right, so this is where we're getting into the different options. Just wanted to reiterate that no build is an option. If you forward a recommendation of plan approval, it doesn't mean that you're committing to constructing any of these alternatives because it is listed as an option to just leave as is. I'm not going to get into this one too much because it's just what's there right now. All right, so alternative 2 is minor improvements to the underpass with the addition of ITS, or intelligent transportation systems, activated warning signage. So basically this would be a sensor that would flash a warning sign if somebody went through that with an overheight vehicle. It would be another warning to the driver not to turn under that underpass and hopefully avoid striking the structure. This would also involve pedestrian and vehicle lighting, which could help with that limited visibility, especially at night. Paving the abutments under the structure. Right now there's a lot of gravel and things that fall onto the sidewalk, and so this paving would help make that a nicer place for pedestrians to walk. And then adding new drainage inlets to hopefully help with that drainage issue. So the estimated cost for this is about $600,000 to $800,000. Another thing I wanted to mention about this is this option doesn't necessarily have to be all or nothing. It could be, you pick that the lighting is the most important right now and do that, or that the overheight warning system is most important. So this could be something that's done in kind of pieces and parts if needed. All right, this is just an aerial of that option. Not too much is changing except you see the overheight warning system right here and also over here. Just once again, reminding people, don't go under there if you're over 8 feet. All right, alternative 3 is increasing the vertical clearance to 11.5 feet. We would have to increase the clearance by lowering the roadway. In talking with BNSF, it would be very difficult to raise the bridge, so anything we would look at would have to be lowering the roadway. So in this alternative, you'd have to lower Montana Avenue's right turn approach and 21st about 3 to 4 feet to get that 11.5 feet of clearance. You'd be realigning travel lanes on Montana Avenue in order to get the space for a retaining wall, because you're going to have kind of 2 different levels of lanes on Montana Avenue. You would have to cul-de-sac Minnesota Avenue because there's going to be a grade difference between Minnesota and 21st, and so you wouldn't be able to drive straight across that. This includes widening one sidewalk, obviously installing that pumping system that we talked about, and then it would probably involve removing parking along 21st Street and in the Montana Avenue lot, which we would have to work with the private property owners there for that. And then this also includes the lighting and the other improvements like paving the slope abutments and things like that. So the cost estimate for this one is about $8 to $10 million. All right, so this is an aerial view of that option. You'd still probably have the overheight warning system, as you're still not at the recommended height for new underpasses anyway, but still would be an improvement in terms of you'd be able to have ambulances go under this underpass, so that would offer an improvement for emergency services there. And then it's a little hard to see here, but there's like a retaining wall right here on Montana Avenue because you'd have kind of that grade separation there. And then kind of the other interesting thing is like this cul-de-sacing over here on Minnesota on both sides there. All right, so next one. So the final alternative is alternative 4, increasing the clearance to 13.5 feet. So this is somewhat similar with kind of one major difference, that being that when you're lowering the roadway that much, you would have to replace the entire structure because you couldn't expose the piers that much, and it still have it be structurally stable. So that does add quite a bit of cost to this option. So you're once again looking at lowering the right turn lane on Montana Avenue, and lowering 21st Street. This time you're looking at 5 to 6 feet, realigning those travel lanes on Montana, the cul-de-sacs on Minnesota, replacing the bridge structure, as I mentioned. You would have to add a shoe fly track, which is a temporary option for the railroad to continue their operations while under construction. So this does also add some cost to this option. Replacing the sidewalks with shared use paths, installing that new pumping system, and then once again, that parking removal in some places. So the estimated cost for this one is $26 to $30 million. All right, so just wanted to show you this aerial view. Again, not too much really has changed here over the last one, except that you're further lowering that roadway to get the 13.5 feet. All right, so we asked the public, what do you think of this? What do you want to see there? And so we got 429 responses to our second round of public engagement. And we asked, what's your preference for these alternatives from most preferred to least preferred? What we heard from the community is that they most want alternative 2, which is the minor improvements with the overheight warning system. The second most preferred was increasing the vertical clearance to 11.5 feet. The third most preferred was the no build, and then the least preferred option was the 13.5 feet. Another question we asked them, which was kind of interesting and a question that Councilmember Neese suggested, was whether if the funding came from a federal source, would that change their response? So we were trying to get at, if it's not coming out of local taxes, how would you feel about this? And most of the people, 80%, said no, it wouldn't change their response. So looking at funding and compliance. So our consultants looked at a couple of funding options. They looked at, obviously, the Federal Railroad Administration. Right now, this project probably wouldn't be super competitive for their grants, as it's already a grade-separated crossing. The U.S. Department of Transportation, or USDOT, does have a couple of other grant opportunities. There's the BUILD grant, and then there's the Safe Streets for All grant. That one probably wouldn't be super competitive there given the current crash data. I just also wanted to mention that federal funds do come with strings, and so if you're using federal funds, that would trigger NEPA or the National Environmental Protection Act. There is some potential for contamination of the groundwater in this location due to the Billings PCE Superfund site. So that's something that would have to be dealt with as we got into design with the engineers and probably in construction. And then most of the alternatives are expected to have minimal impacts under the USDOT's Section 4F, which is kind of looking at public places and public resources, and then also under the Endangered Species Act. All right, so kind of more into that compliance issue. So the existing railroad is likely a significant historic resource under the National Historic Preservation Act, so that would just be another thing we'd have to work through. Improvements to Montana Avenue would trigger the Montana Environmental Protection Act, or MEPA, because that's a state route, so we'd have to work with those regulations as well. And then alternatives 3 and 4 would require local stormwater review and permits and things like that. All right, so I just wanted to review with you this transportation planning process. As I mentioned before, it's a little confusing. It took me probably a couple years to figure it out. So just want to review that with you. So the whole process starts with our technical advisory committee. And so this is for anything funded by our Metropolitan Planning Organization, or MPO. So the whole thing starts with our technical advisory committee, or TAC. They did forward a recommendation to the governing bodies of approval of this study. And then we went to the planning board, who recommended approval to the policy coordinating committee. And so we'll be asking the county commissioners on June 23rd and the city council on June 22nd for their recommendations to the policy coordinating committee. You all are represented by the mayor on the policy coordinating committee, so whatever action you take, he'll take your vote to that body. And then the PCC, or Policy Coordinating Committee, takes action on July 21st. And then that's the final adoption of the plan. With that, I'll open it up to questions. And John, I don't know if you have your camera on, but I might call on you if there are any questions in your realm. Thank you.
Thanks very much. That's a pretty good presentation, and I know we got a couple questions, starting with Mr. Kennedy.
This underpass has been a problem for many, many years. My father and his Nally's truck tangled with it in the 1960s. So it's been around a long time. We, 20 years ago, we looked at the over and under and around committee, which we looked at South 27th Street. The businesses did not want to put a under, and they did not want to put an over. And so that started looking at 21st Street. We looked at it. We worked with Burlington Northern at that time. Burlington Northern didn't want to do a darn thing with it, and was recommended just some signage. I couldn't go forward with this. I think the more studying we do, the more whatever we're spending money on is a lot of money for nothing. I think if we're going to look at a route to the south side, we put more money into 13th Street and make that a viable route. And you're really trying to push, or who is ever pushing this, is it's not going to become a reality. And just like 27th Street, we spent a lot of money on studies. We spent a lot of money on studies on this, and it's not ever going to come. 13th Street could use a little bit more. We complained enough. We got 6th Avenue underpass, 6th Street West underpass working, so it works. And then if you had a little bit more signage or whatever, and people would read, they probably wouldn't get stuck there. So, I would go with the do nothing at this time. That's an awful lot of money to put into an intersection. If you sit there, as I went under it again today, which I do at least once a day or 3 times a week, there is adequate sidewalks on both sides. There's very few people that walk it, except for the black rabbits down there. And really, on the whole, most people, except when the train is running, use the 21st Street. The rest of the time, it's not used as much, but 13th Street is. So that's my comments.
Thank you, Mr. Boyette and Ms. Shaw.
Thank you, Mayor. So let's say the city council makes a motion to forward a recommendation of study adoption to the policy coordinating committee. We actually give all four alternatives are part of that. We don't need to pick an alternative. We just say, here's the plan. There's 4 alternatives. 100 years from now, there's money. You guys can pick one of those 4. That's all we need to do tonight.
That's correct, Councilmember Boyette. Yes, we're not asking for you to commit to any one of these alternatives now. As you saw with Alternative 2, there's potentially some lower cost things that could be done that were explored as part of this study to help improve that. But it does set you up and provide you with the information if say the perfect grant comes around. Right now, we're going through transportation reauthorization at the federal level, and they're kind of reworking the transportation bill. So you never kind of know what's going to come up next, and this makes us for all those opportunities. Thank you.
Michelle?
Sorry, thanks. I definitely think we should accept the study. I get frustrated that we spend a bunch of money on these studies, and then if council doesn't accept them, that is truly just throwing it in the trash. So we're not being asked to pick any of these. I firmly believe our recommendation should be yes, we accept it. I did have one question for you, Elise, which is says that we need to submit a request to MDT to add the roadway to the urban system to be eligible for federal funding. What is that process like?
So yes, and I may rely on Laura a little bit. So as I mentioned, our MPO, Metropolitan Planning Organization, we get federal funds for transportation construction projects. In the past couple years, a lot of that money has been tied up in the Billings bypass, but some of it is starting to become available. So if it's something that we wanted to use that federal funding on this project, we would have to work with MDT to get this route added to the urban system, because you can only use those funds on the urban system. So if you have any more questions, I might turn to Laura, but that's a general overview.
Well, that's perfect. I mean, I think it's something we should do. My concern personally is getting an ambulance over there. I think the South Side has a fire station, but it's the clearance for an ambulance that just gives me heartburn that we don't have that. And so that's where I'm coming from in terms of it being a safety issue. My hope would be in the future, maybe there'll be federal funding that this might be the right niche for. But if we don't accept the study, then we won't ever have a shot at that. So that's my comment. Thank you.
Thank you.
Mr. Neese?
Thank you. This was a great study to be a part of. Thanks. And you had some good consultants there. We looked at a lot of different things, and we came back an extra time or two because I didn't like what was there, and we redid some of it. But this was started in prior council. I think Mike, you and Kendra, you were there at the time. Councilmember Yakowicz was concerned about the safety of the residents being able to cross there, and equates to ambulances and things like that. So that's really what kind of drove this, and he's now Senator Yakowicz, and so we can hopefully get some state funds as well and grant funds sometime in the future that maybe do one of these options. It is a long shot on the 30 million to get them light up, because I personally would like to have seen that fire trucks go through there, and if we get ambulances, that's great. And if I remember correctly, the time delay to go around to 13th Street was, what is it, about 5 minutes or so? Chief Hopple, do you remember? Well, we can.
John online, if you remember that delay.
Well, anyway, the point is when you're in an ambulance, minutes is life. It's very important to try and get at least ambulances through there. So I agree. I think we need to get this added on to whatever plan it needs to be. So if a grant comes along, we can maybe get option 3 in there and get the ambulances going under. But as it is now, I think adopting it as is. I like the idea of option 2, because you can do piecemeal it, and we can add different things. The TIF districts can probably assist in some of that, get some of that stuff cleaned up so that all that dirt and gravel isn't running down, and just make it look nicer so people actually are not trying to avoid it, but actually can use it. So I look forward to seeing this go forward, and maybe someday we'll see something develop. Thank you.
Go ahead, Mr. Aspenlighter.
Thanks. This again is not going to be a surprise. I tried to kill this study when we were halfway through, and Roy beat me on that vote. So I'm firmly in the camp of no action with this. It does not have the ADT to justify it. It doesn't have the crash data to justify it, which is why it doesn't get any MDT assistance. It's not on route, and it's never going to get added to the route because of the low ADT, and MDT is in the process of taking stuff off the system, not adding to, because MDT doesn't have any money either. So, I think the likelihood of those things actually happening are way, way low here. So I mean, I'm kind of at a loss as to why we even finished, but we finished. And I'm in the camp of do nothing. And even if we do adopt it, I hope that we don't see something creep into a CIP. Because when we adopt these plans, that's absolutely what happens, is that something then gets stuffed into a stinking CIP, and then we all of a sudden have a project creep up because we adopted a plan. And that's always the answer from staff. Well, you adopted the plan. That's why I don't want to adopt the plan. Because then something gets stuffed in a CIP, and then all of a sudden we do something that we didn't want to do anyway. So that's my position. I'm probably going to be against it for that reason.
Mr. O'Donnell?
Thank you. You mentioned the ITS with a warning. Would that be on every car, or I mean every car that goes by there, or just the ones that are detected above 8 feet?
That's a great question. Thanks, Councilmember O'Donnell. I'm just scrolling back to see if I can find a picture of it. Let's see. Okay, so this is kind of showing you what it would look like. So basically, and maybe John can join in if I'm explaining anything incorrectly, but basically there's a sign with a beam of light being shot between two sensors.
Right.
And so if that beam of light is broken, then it senses an overheight vehicle and it'll flash the sign and tell them not to go
Just
through.
for oversight, okay.
Yes, just for
Wouldn't happen
overheight.
to every vehicle, okay.
Thank you.
Number two, you mentioned that 80% of the accidents were bridge contact. That means 1 out of 5 are just cars running into each other?
John, can you jump in on that at all?
It's hard to tell. It's hard to tell what's happening until you get, there's just not a lot of information for every single crash to tell exactly what happened. So we look at the way it's coded, and there's ones that say they hit a fixed object in that section, and some of them will locate the bridge, some won't. We did get lucky and get the fire department does keep track of this ones they respond to, so they kind of confirm generally the number. But we don't have a lot of details on all those crashes. It could just be they hit the guardrail under the bridge, or they ran into something. One thing we do know is there was mostly property damage. There was only, I think, a couple crashes that had injuries. So it kind of tells you that they probably are just hitting something. But most of them, they weren't if I remember right, there wasn't even, a lot of them weren't multi-car cars either. It was hitting something all by themselves.
Thank you. BNSF, have they indicated that at any time that they do regular maintenance on the bridge that has to do with reconstruction or re-railing or anything like that? Is anything coming up, or is it just going to be the same as far as they're concerned for the next 100 years?
Well, that's an interesting question. I don't know if John has any more, but a little anecdote I like to share is when I was doing research on this project. So they replaced the bridge in the early 2000s. And before that, the bridge was a wooden structure from about 1908. So that is quite the lifespan. So I'm not sure that they've got anything coming up super soon, but John, if you've got anything else to share, please do.
No, they were pretty clear that, this bridge was replaced 20-ish years ago. That's well under the life of the bridge. They do maintenance. They were very particular in saying, don't hang a bunch of stuff on the bridge that we have to maintain. So they do look at that, but bridge lives are substantial. So I wouldn't expect any replacement, at least for the next 20-ish years.
Okay. I just have one other question. We're all used to seeing the type of crash where somebody has a boat strapped to the top of their camper and it runs into it, or something runs into it. Does it ever cause any damage to the railway functioning up there? Do they have to stop using the tracks for a period of time Is it bothersome to them that we could use as leverage to them to say, if we fix this thing, it would be to your advantage?
Sure. John, I might turn that over to you as well, if you don't mind.
To our knowledge, they haven't had situations yet that they have seen that type of interruption. If you look at the pictures and you go out there, they've put quite a, they know when you put something this low that you're going to have that happen. They have quite the apparatus to protect the bridge. So, to our knowledge, at least when they spoke initially to one of our team members at HDR, that they didn't see a big problem. In fact, they didn't even, I don't believe they've responded to too many of the crashes because, it's happened, it's cleaned up, and there isn't any of an issue. There is a risk, though. They do see the risk. So they understand that, crashes bring a risk of something happening. When I look at it, I'm probably less concerned about a vehicle hitting the structure unless it's a very huge vehicle. But, let's say vehicles were to, hit the structure or something, then get in then start a fire or something. It's that kind of thing where you could damage a lot of stuff if you had some incident, and it maybe not be the impact that gets it, but it's the rest of it. But so they do see that, and as Elise said, them and the city kind of looked at some of these options. It was much more in a much faster pace during design, but they looked at increasing the height and probably, I think they probably went through and identified, and we know they identified some of the issues, but I think they probably had a lot of the discussion that's happening here, where there's a lot of trade-offs and a lot of money, so so I think that's how it ended up just staying at 8 feet.
Thank you.
Mr. Pittman.
So I was around during the over, under, and around study, and I'm not sure how much we spent on that. Now we're spending money on this. If we accept it, does it just get put on a shelf and then we stop talking about it until money magically falls from the sky?
I think that kind of depends on if there was a desire to implement any of these, and I think especially alternative to. This is something that I could see if the council wanted, potentially working with the Public Works Department that, maybe some of these things are added in the future, but we're not saying that, by adopting it, it's going to get included. That would be kind of like a discussion about getting some of those things included, because if you kind of piecemealed some of this, it might not be super expensive, at any one given time. So.
Mr. Nicholson, Dr. Nicholson. Sorry, sir.
Thank you. The problem I want this to solve is transporting a seriously injured person or seriously sick person from the south side to the hospitals. What I'm trying to say is, what is the magnitude of the problem of having the railroad between the south side and the hospital? How much time? How often is there a delay? And it was I'm not sure that this underpass would make a big dent in that. So do we have an understanding of that?
Yeah, and John, I might turn that over to you again as well, if that's okay.
So we did look at what was kind of going on between 27th and 21st. We didn't focus a lot on 13th, although we did have traffic counts there. It was, to give everybody an idea, at least in our analysis, there were about 18 trains during the day, 18 trains during the night. So a reasonable amount of trains came through fairly slow. Most of them operated relatively slow, 5 to 25 miles an hour. I believe, I'd have to look it up. I believe the average time was somewhere in the, I thought 4 or 5 minute delay, but I would have to go back and look. So I don't want you to quote me on that. But it did, there were a lot of trains. The delay just wasn't huge, so we didn't find a huge amount of diversion, just because I think some people's routes probably they know the trains, so they either certain times of the day they either just use these other options, or they just know it's only going to be a few minutes and they'll just put up with it.
Further questions? All right, well, seeing none, thank you for the presentation.
Thank you.
The staff is not asking for anything except that we hear it, and we have. So let's open this up to then public comment regarding item number 1. Any public comment regarding item number 1? All right, thank you.
Thank you.
We'll move on then to item 2, nurse navigation program.
Good evening, Mayor and Council. I appreciate the opportunity tonight to put something before you. Tonight, we're not obviously looking for a clear decision, but we just wanted to get in front of you and share a concept with you that was brought to us by our EMS provider here in town, American Medical Response, or their parent company, Global Medical Response. And just kind of looking for support from you as we move forward into this project. Really, I think after the presentation and speaking with this company, I think they have the data to support the success in this program. Where this comes from with nurse navigation is really goes back to the CPSM study that we did in 2021. And specifically, as you saw in the council memo, we talk about recommendation number 20. And this is an ongoing project. This is something that we probably don't go a day without trying to address this. It's not a one and done thing that we do. It's always trying to improve. And basically, item number 20 talks about working with 911 dispatch center to implement response protocols, alter the BFD response mode when calls are determined to be minor or non-emergency. The document does go into a little further explanation of what that is, but long story short, we're just always looking for the most efficient way to make sure we have our resources available for those critical type calls and maybe an alternative response to some of the low acuity calls, in some cases, no response at all, to keep our resources available for when they're needed. So we are constantly having those discussions with the 911 center, with our partners in EMS, and all the other agencies within the county to figure out what that is. We were presented this option, nurse navigation, a few months ago, and just wanted to share it with you. We think it's a great concept, and I will have them expound on what that is. They're going to do the presentation tonight. But tonight we're just wanted to get the education to you because I'm sure it will become public. We did have Q2 visit me this afternoon. So as it becomes public, if your constituents start to ask you about it and what it is, just wanted you to have some more information. And I think it's a great program in solving that very hurdle that we're trying to get over with number 20 in the suggestions. So with that, I'll talk about the next steps and what that is. So if tonight, after the presentation, if you feel like we should continue to move forward with this and start to try to integrate this into our dispatch system, obviously, we would not be able to fully integrate it until it comes back to you in an agreement that we would have between Global Medical Response and the Billings Fire Department or the City of Billings. That would go through the normal process of a council meeting, legal review, everything that goes along with that. So tonight is just an educational session of what nurse navigation is. Our next steps, if you decide tonight that we should continue forward with this, obviously we need to start visiting with our medical director. working with them because they oversee all of our protocols, how we dispatch people, working with our medical providers in the community because they are affected. Both hospitals are affected by this, and gaining their support, and then just obviously working on an agreement that we would eventually bring back to you. So with that, I will bring Steve Moffett with Global Medical Response. They are the parent company of American Medical Response. That is our primary EMS agency in the city. Steve?
Good evening, everyone. I appreciate the ability to be here right now.
Could you pull the microphone a little closer to you?
There we go.
Yeah, you are pretty tall there.
Yeah, no, that's all right. There we go. Now everyone can hear me. Perfect. Good evening, everyone. As Chief Oppel mentioned, my name is Steve Moffett. I'm the business development manager for GMR's Nurse Navigation Program, and I wanted to take the opportunity to give you an overview of exactly what the Nurse Navigation System does and sort of the reason why we do it and the way that we go about doing this so that you have a better understanding of it before we move forward. With this, when you look at the healthcare system in the United States, what we have seen and what we've been able to gain statistics on and real solid data is that 911 call volume is increasing year over year. It doesn't matter where you go, that is something that is across the United States. And what we've also seen is that the response time to these low acuity calls has really little to no impact on the outcome for these calls. We also know that based on the data we can collect, 93% of these calls that we're responding on, they don't require any sort of life-saving intervention from the pre-hospital care providers that are providing that care. And 88% of those require nothing from the hospitals that they're being transported to. So we see a real opportunity to impact care and also impact the 911 system. Because what we're seeing is that there's really a supply and demand issue. We see that the demand for EMS is going up, but the supply is not there to meet that demand. That's been an issue for a very long time. I've been in EMS for over 20 years, and I'm a second generation in EMS. We've seen this over the course of our careers. So what we're trying to do with nurse navigation is we're trying to reduce that demand. We're trying to bring that demand down to a more reasonable area. The nurse navigation model, what we're doing is if you look at the picture here, if you look across the top, that's how 911 calls are handled today. The call comes into the 911 dispatch center from the caller. The dispatcher asks a few questions, gets a determinant code. They dispatch field apparatus. They respond, they assess, they treat, and they transport the patient. What we're doing with nurse navigation is we are giving the dispatcher another option. We're giving them the nurse for those low acuity calls that they can send the patient to. The nurse really does two things. Number one, they act as a safety net. We hire nurses that have an emergency care background. There's a lot of nuance in what we do in the emergency care sector. And so they're able to have an idea of what the patient's talking about. They're able to act as that safety net to recognize when maybe it's a high acuity or a high priority symptom that has gotten through and redirect that right back to the 911 system the way that they should. After that, then what they're going to do is they're going to look at it and they're going to ask the patient more questions. They're going to use our algorithm. We call it an MTARA. Basically, where do you need to go? When do you need to get there? And how do you need to get there? The resources that we use are self-care. So getting a patient educated on how to take care of themselves at home, getting them to a virtual care provider, a telehealth provider, or a mobile intensive, an MIH, mobile integrated health. There's also community care resources that we utilize. And when we talk about those, what we're talking about is the urgent cares, dental clinics, behavioral health clinics, and FQHCs to get patients a level of care that they need that's right for them at that time, but that's not going to the emergency department. We also understand that sometimes a patient needs to go to the ER, but they don't always need to go to the ER by a 911 ambulance. Sometimes they can use a BLS ambulance. We also partner with Lyft and Uber, as well as we can find a way for someone to get there via their own vehicle. But we use various different models to figure out how to get the patient to the right place at the right time. Now, just so that you're aware, this is not something that we just kind of pulled out of thin air. This is not something that we just made up on the fly. What we have used is an ESO study. ESO is a unique public safety software provider, And they have both dispatch or pre-hospital and in-hospital software where they can track a patient from dispatch to the time they're discharged from a facility. ESO ran a study where they did a retrospective study of 1.7 million patients. What they found was that in the calls that we designate as omegas and alphas, those are our lowest acuity calls, there's a real opportunity to reduce the demand on the 911 system, thereby freeing up those resources for the high acuity patients. This is roughly how it breaks down. This is our historical data from the nurse navigation program. You'll see there that about 3% of the calls will go back for a high acuity or a high priority ALS response back in the 911 system, the way that we're doing it today. Once you get below that, you're going to see that we do have about 40 to 50% of the calls, depending on the jurisdiction, that will go to an emergency room by a BLS ambulance. What this does is it frees up our paramedics in our ALS ambulances to respond to high acuity calls. And this can be for a variety of reasons. They may need some sort of clinical monitoring during transport. They could have mobility issues. If a patient can't walk out their front door and get to the curb to where a lift would be, they can't be taken by lift, even though they may be appropriate to do so, but we'd have to send a BLS ambulance for those. There's also that small 8% portion where it talks about unable to complete a screen. There's the understanding with this being a new idea in EMS. This is a new concept of what we do in public safety. And some people, because we've built in a Pavlovian response really in the community of you call 911, you get an ambulance and a fire engine. People are used to that. They have been since the 80s. There's many times when programs first roll out that they say, I called 911, send me my ambulance. We don't refuse anyone an ambulance. So we will send you the ambulance. Those are those unable to complete the screens. We do have the ride share to the ED, and then looking down at the bottom, roughly 30% of our patients are seen out of the emergency department completely. They're getting referred to community care or self-care or telehealth, making sure that they are freeing up those beds in the emergency departments for the patients that really need them. As far as the infrastructure that we've built to properly support this program, we have at this time currently 2 communication centers in the United States. We're staffing over 70 nurses. That number has actually come up. We're closer to 90 full-time nurses on staff, 300 calls a day, and we have a fully integrated communication center. Basically, the communication center that you would see here for your local fire police, it looks just like that. It is housed in our National Communication Center in Lewisville, Texas, and also in Phoenix, Arizona. Also, there's a maturity process that's involved in this. This is something new. This is something different. This is also something that we can't just flip a switch and turn it on full bore tomorrow, because if we did, it probably wouldn't go so well. So we built in a 3-phase maturity process. In phase 1, in our foundation phase, that's through the implementation, roughly 5% of the EMS call volume would become eligible to go to a nurse navigation. In phase 2, then you're looking at roughly 10%. And by the time you get to phase 3, roughly 15% of your volume here, actually in the Billings area, based on my analysis, it would probably be a little over 15% would be eligible to go to the nurse navigation and to be navigated out of the 911 system from that. The implementation process, I know it says 90 to 120 days. That is currently at 90 days. From the time that we say, yes, this is what we're going to do, and we officially start our implementation until it goes live takes 90 days for everyone from the fire department, from AMR, and from the communication center to get together, as well as the hospitals and the medical directors, to make sure that everything is aligned, make sure that all of our processes are in place, and to make sure that all of our IT, both hardware and software, is updated and ready to roll out. And then within 90 days, we can go live. Now, a key part of this, as we already mentioned, this is something that's new and different. A key part of this is getting buy-in from the community. What we have found in our process is that we've been able to get buy-in, and we've been able to get very positive buy-in from the communities that we currently support. Part of our being able to do that is making sure that the perception from the citizens is positive, and also that the perception is quick, that they are being taken care of in a timely fashion. Right now, we're averaging less than 25 seconds from the time they transfer from the PSAP, from the current local 911 center, to a nurse. That gives the nurse time to know who's calling, to make sure that they have the proper protocols that are approved by the medical director pulled up and ready to go. Right now, we are currently averaging less than 10 minutes from the time they are transferred to a nurse to a time that they have a complete plan ready to go and fully implemented, meaning the nurse has talked to them, asked the questions, determined how best to care for them, where to get them, how to get them, and then they've put that in motion. If they do go to telehealth right now, about 18 minutes to get a telehealth consult, and if they are going to go to a clinic or a community care resource, about 42 minutes from time of call until they arrive at that clinic. One of the unique things that we're able to do is any patient not going in an ambulance, any patient that receives any other care that is not an ambulance, will get a follow-up phone call. We try 3 times to get a hold of them. At 24, 48, and 72 hours is, I believe, what our current customer experience team is utilizing. And we ask them questions. We want to make sure that what we're doing is aligning with what they thought was going to happen and is also going to be a positive experience for them. Currently in the United States, we're at 4.8 out of 5 stars. We ask them, give us a rating, 1 to 5 stars. How would you rate our service? Right now, 4.8 out of 5 stars. So we've been able to prove that the program that we have implemented is something that people are willing and desire to engage in. Above and beyond that, not just for the public and their perception, but also from the local AMR operation. What we've noticed in the local AMR operations where we've already deployed this program is that it has significant operational benefits. As already mentioned, one of those is making sure that the ALS resources are available for the high priority calls. If they're not responding to these low priority calls that is taking them out of service, then they are available for those calls that matter the most. The other thing that we notice is that we have a much higher customer or a much higher employee satisfaction rate in those areas. Coming from being a paramedic myself, that made perfect sense to me. Because if a paramedic goes through paramedic school after already being an EMT, they go through, honestly, it's blood, sweat, and tears. You live and breathe this every day going through school. And when you come out, all these skills that you just worked so hard to attain, you don't get to use all the time. All of a sudden now, a nurse navigation program is taking some of these low priority calls out of the system. You are able to use your skills more often. You're able to better hone your skills, and it makes it so that the crews are happier coming to work every day, which leads to better recruitment, better retention, and also better service to the community. Here's a slide that I apologize, it is kind of a busy slide. There's a lot going on here. This gives you an idea of what nurse navigation currently is, where we're at, and what we do. Last year, over 76,000 calls went to nurse navigation. Year to date, we have 45,000 calls have gone to nurse navigation just this year. So we will most likely eclipse 100,000, and we have already done 300,000 successful navigations since the program's inception. And also, if you look down here at the bottom right, that's going to give you an idea of just how far and wide nurse navigation has spread. We are currently covering over 25 million Americans with the nurse navigation program. So now the fun part. What questions can I answer for you?
Thank you. If the caller has a problem due to a mental illness, does that change the algorithm?
Does it change the algorithm? No. So the low acuity calls that involve a behavioral health complaint, we can navigate those as long as the patient is no longer, or as long as the patient's not in crisis. So any behavioral health non-crisis patient, we can navigate either to a behavioral health resource or the community response resource that the fire department could potentially also have here. We can navigate those as well.
If it is a mental health crisis, what do you do?
So if the patient's in crisis, then the EMD coding, the determinant code, would most likely make it non-eligible for nurse navigation. If the patient is in crisis and it does get through to the nurse, they would recognize that the patient is in crisis, and it would go back to the public safety answering point for a regular response as we do today.
Mr. Lindley.
Thanks, Mayor. Questions I have are around the economics.
Okay.
So I understand the city's not paying for this service.
That's correct.
Are people that get serviced by a nurse navigator paying anything?
So there's no cost to the patient for the navigation. So what's included in the navigation is the navigation itself and the cost of the Lyft or Uber rides, the ride shares. The ride shares, if they're going to an emergency room, we cover from the point of where they've called to the emergency room. Emergency rooms have their own process for getting patients home from the ERs. If they're going to a community care resource, we cover the cost of the ride from home to that resource and back with a stop along the way if they need to stop at a pharmacy or something like that. The only time that the patient's going to incur a cost is once they get to the clinic, the urgent care, the ER, or if they are transported by an ambulance, just as they would today.
So, quick follow-up. So let's go one step further.
Okay.
77 nurses and all that IT software and hardware is not cheap.
Correct.
So there's definitely a revenue increase for the organization. I'm sure that it probably comes from reduced number of dry runs. Do you know what that impact has been, and has that made you guys keep your rates steady or potentially dropped your rates for ambulance rides for citizens?
That is highly dependent on the jurisdiction, because in some states where we've implemented this, our rates are not dictated by us. In some states they are. I can tell you that yes, we do reduce dry runs in the tune of usually 5 to 10% reduction in dry run rate. And yes, everything you said is correct. Having 90 plus nurses and all the infrastructure, that is not a cheap thing to do. That costs a lot of money. The funding for that here in Billings would be borne by the local AMR operation. So the AMR operation would be funding it. What we found is that while this does cost money, and what everyone's paying, the operation goes into that, but it's also, we found it to be the right thing to do, not just for the community, but also for our people, to make sure that we are staying available for the right calls at the right time. And so honestly, a lot of times it's a break-even sort of situation. It's not a revenue driver by any means, but it's making sure that we are able to capture the right patients at the right time.
But one final comment. I candidly would not agree with that last point. There's no way that it's not a revenue driver. I mean, the medical system in this country, as everyone here knows, is based on profit. So I think it's a great program. I don't want to, I think everything that you described, how it would impact getting the right people connected to the right things is great. However, I'm certain that it is also a revenue driver.
I would say that the nurse navigation program in and of itself, if you were to isolate it on its own, it would not be a revenue driver, just based on the fees that we charge. However, making sure that our units are available, that we're making sure that we are on time to the right patients and making sure that we are available, that does drive overall revenue for the company, because we're making sure that we are performing the way that we're supposed to. So we're not getting fined for late calls in the areas where that's applicable, and we're making sure that the patients we're transporting are the right level patients.
Okay, Mr. O'Donnell, then Ms. Shaw, then Mr. Pittman.
Thank you. Thank you for, this is quite startling information to see that, as I recounted, 48% of the calls do not require an ambulance role on the whole thing. However, and you're doing something proactive on that. That is really good, because the system is being used more efficiently. So I applaud that. One thing though, you had the phase 1, 2, and 3.
Correct.
On 3, you were offering 10 to 15% reduction. The difference between 48% and 10 to 15 seems to be a wide gulf right there. I don't understand how the program, is that the maximum efficiency it can do to save 15% of the rolls?
So when we're talking about the 10 to 15%, what we're talking about is the overall percentage of EMS volume that would be eligible to be sent to a nurse. Now, once they get to a nurse, that 48% are the ones that would not require an ambulance.
Okay, great. Thank you.
Thank you. I think if I understand what Councilmember Lindley was kind of getting at, it's that the bottom line goal is like, we don't want ambulance rides to become more expensive because we're adding a new program that impacts our community. That would be a concern for me. It sounds like that's not what's happening, but that would be something I'd be concerned about if that's part of the model. My question for you is, we live in a relatively rural area, and so our 911 sometimes will get calls from out in the county that they can't respond to for 45 minutes or 30 minutes. Is there a place in this flow chart where a 911 operator is saying like, okay, we've dispatched whoever needs to be dispatched, the ambulance, blah, 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 but someone's going to stay on the phone with that person? A nurse would be great in a lot of cases, especially if you have like an accident on a ranch or something, to talk people through what to do while they're waiting for it to show up. Is that at all part of the flow chart?
So that's not part of the nurse navigation program, simply because our nurses are being specifically trained to deal with the low acuity symptoms and to deal with those patients that are having those low acuity issues. Usually in a traditional EMS system, the one who's going to stay on the phone is going to be that dispatcher, assuming that the volume allows for them to stay on the phone. But no, that's not part of the nurse navigation program.
Okay, thank you.
So what would be our next step in this process? I know this is informational, but what do we have to do to get to the next part?
So the next step in this is we would have to work with the fire department and the city to make sure that the contracting aligns with our current contract within the city for the AMR ambulance operations, making sure that the legal teams and everyone is okay with what we're doing. Once we get that done, it's my understanding that the next thing would be, once we have the agreement set up, it would come to you for final approval. Once we would get final approval, then we would begin our implementation. From day one of implementation, you have 3 months, and then we would go live in the city.
Just a follow-up. So I guess this might be to Kevin. Is this something we're actively having a conversation about, or how do we at least engage in this conversation?
So Councilmember Pittman, that's what tonight's for, is that informational. And then if council wants us to move forward, then we're going to start working on all this stuff that Steve has been saying tonight, and then bring that back to you in a contract form, and then we would be off and running.
Thank you. A few questions here. I think when I look at the costs, I think the dollar amounts have been covered, but I wanted to talk about I think you said the average is 25 seconds to transfer from our EMS system to you. And so is there a metrics that you guys will shoot for? Is 25 seconds high? I mean, that adds 25 more seconds to the citizen who called in. And then the second part of that question, I've got another question, but the second part of that question would be, you mentioned sometimes it has to go back. And so
correct.
What's the process when it comes back? Is it then have to go through the whole EMS system, or is it somehow priority routed to do whatever it needs to happen?
So to the first part of your question, the 25 seconds, that's the average that we attain, or that we strive to attain for. And what that does is it gives two things. Number one, it lets the caller know, gives them the standard recording of, thank you for calling the nurse navigation line, or however it is that would be branded in this market. And please hold for the next available nurse. It gives the nurse time to understand that they have a call coming in from, say, Billings, Montana, where each medical director can determine what does and does not go and how those calls are handled. So it gives them time to pull up on their side in their CAD system the correct community care resources and get an understanding of what's available to them at that time. So it's just time for everyone to make sure that they're getting on the right page. So as soon as they get on the line with the nurse, then they can be off and running.
So if I understand correctly, our system immediately sends the data that maybe the 911 operator talked to about to route this based upon the call code. So they're going to have 25 seconds or less to read that information, get in a mindset of what this person is experiencing to be able to handle the call, and then it connects.
The 25 seconds is the call transfer time. There's about a 10, 15 second, just like if your dispatch center here were to send a call to, let's say they had to physically call AMR or they had to call a neighboring county to turn over a call to them for mutual aid. There's that 10, 15 seconds of I have a, whatever their age and gender is, this is their complaint and this is where they're at. And then after that, then your dispatcher would get off the line and go back to being free for receiving other calls, and then it would be on for the nurse.
Okay, but what about return rates and how often are calls returned, and what's that process look like to give it back to 911 operator?
So the calls being returned for a 911 response, for a high priority response, right now we're at like 2.8. So we say 3% of the time a call is going to come back. And the process is basically the same, just in reverse. The nurse is going to have a back line to call into the dispatch center, where they'll call and say, that call that you just sent us at this address, I need to have an ALS response with an imaging company or whatever the appropriate response is in the jurisdiction. I need you to respond to that. They would not have to go back through the EMD process and ask all those questions over and over
Okay,
again.
picks up the same code, whatever call
Correct.
code is.
Yep.
Okay, and then I'm sorry, I don't know if you answered my question on the, do you have I think you said 25 seconds is what you strive for. Is that a goal that you report to users like us to make sure that you're achieving that goal? And if it's not, what do? You have to hire more nurses. I mean, if you're bringing our system on, you may be bringing other systems on. I just want to make sure that we're getting the service that we need to get.
Yes. So the 25 second is our average right now. That's the average time. So obviously, middle of the night, you'll probably get a shorter time. Sometimes during the day, you might get maybe a little longer, but that is our average currently over the 40,000 that we've done this year. The process for that, with having more nurses come in, all of that good stuff, really, when we go out and we look at, hey, part of the implementation process is going to be, do we have the sufficient staffing? Do we have what is going to meet the needs of not just what we're currently doing, but what we are anticipated to do in the next 3 to 6 months? So this is something that's been planned well ahead.
Okay. And then another question I have is, what's the difference between someone just calling up, ask a nurse, getting that information versus going through 911 and then getting your nurse navigator?
So the nurse navigation program is designed for those people who are calling 911, and they call for various reasons. One of the data points that we collect when we do our follow-up survey is, why did you call 911? Sometimes it's just that they didn't know where else to get care. Sometimes it's that they didn't have transportation. They didn't know what else to do, so they called 911. It's the easy button for a high percentage of the population. And what we're doing is making sure that they don't stop that, because if we build into them, no, don't call 911, well, then when they need to, they may not. So we still want them to call 911. We just want to make sure that our local system is able to take care of the high priority complaints and make sure that the low priority complaints, while they are still being taken care of, but they're being taken care of in the most efficient way possible.
Okay, so you referenced early on about the Pavlo response and so you're hoping to change that Pavlo response by having, once they go to the nurse navigator, realizing that you don't have to call 911, you can go directly to your provider, and maybe that'll lower calls altogether.
We would hope. What we've seen statistically and through our own historical data of doing this since 2018, that's not always how that works. Call volume still goes up. They still call because call volumes continue to go up. What we're trying to do is we're trying to get them tied into the right level of care. A lot of people use the emergency department as a primary care because they just don't have another option, or they're not aware of another option. We want to make sure that they are taken care of at the right level and getting them to that right level of care. If that means getting them to a clinic where they can get embedded with a primary care doctor, they may not have known that. They may not be educated in how the healthcare system works. I work in the healthcare system. I have for over 20 years, and I am still confused by my own insurance, and I have decent insurance. So navigating my own insurance when I know how the system works is confusing. Someone who has no education in that and doesn't have that experience, it's overwhelming. So if we can get them to a different resource that's not an emergency department to get their core issue, their chronic issues taken care of, and getting them embedded with a primary care physician, yes, hopefully they no longer have to call 911 to go to the ER for every complaint that they have. And that becomes, hopefully we get them away from that being their primary care and we get them to real primary care, knowing that the way things go, call volume continues to go up, we're going to have someone else to help.
Okay, and Mayor, one last question. You mentioned that you have a 4.8 rating, which is good, but what percentage of respondents are actually responding to those call outs?
Right now, I believe we have a 40, I think this year right now we're at like a 42 to 46% respondent rate.
Respond rate, okay.
Yeah.
Thank you.
So we wish it was higher, but again, when you're calling up after that, a lot of people just don't want to talk and take a survey.
Thank you.
Okay, Ms. Aguirre.
Thank you. Am I understanding that your nurses are not locally sourced?
Correct. So the nurses physically sit in one of our call centers in either Phoenix, Arizona, or just outside Dallas, Texas. However, all of our nurses will not take a call until they're licensed in the state they're taking the call from. So you would not have a nurse that is not licensed in the state of Montana taking a call. So they would only have Montana licensure. So our nurses carry a substantial amount of licenses in order to handle that.
Do you find that it hinders in any way their lack of knowledge of our local community, like what the resources are or access points?
I don't think that it would hinder their knowledge of resources. Every program site has an account executive internally that handles that, and we work with the local team. One of the things through implementation, our account executive can go through and Google and say, okay, what are our community care resources? What urgent cares are available? We're going to fact check all of that with the local resources to make sure that we have it right, to make sure that we're not sending someone to a place that, sure, the internet says that they're great and we call them and they say they're great, but does the fire department, do our local AMR operators, do they agree that that's a place that we should be sending patients? So that's part of our implementation process. And also, and to go back to Councilmember Neese's point, they continue to interact. So quarterly, they're going to meet with the fire department, with AMR, with the hospitals as a joint operating committee to say, this is what we did last quarter. Here's areas where we can improve, and here's how we're going to improve it. And we give the fire department and the local operations access to in-time current data on their program. So they can log into a Power BI dashboard and see in real time what's happening currently for the nurse navigation program in the city of Billings.
Okay, thank you.
Mr. Kennedy.
I like the idea of this. We talked about this quite a few years ago with the crisis center and the problems we had in the emergency rooms and the problems we had with law enforcement. What do they do with people that need some help and are in crisis? I like this idea. I'd like to see something like this work, but I would like to see it over a certain period of time and some data coming back to us so we really know it is working. I have a question. Do you indemnify the city in case if it's transferred over to you and your nurse navigators and there's bad advice or bad things coming out, do you indemnify the city?
So the medical director for the communication center is going to be responsible for what they determine is appropriate to send over. Once it comes to us, then we bear the liability of how we handle that call.
I would just want to make sure we have that, Chief, on something. So we are not holding the bag because the city is usually the one that people really want to sue and go forward on that. The other piece that I have is I know the firemen and the police and the ambulance service all respond because people panic They want service right away. They may have someone on the ground or someone bleeding or whatever, and they panic. So once we have to do a large education program, because that's real important and that should be in this. But after the first year and we educate people and this is showing real positive numbers and same things like that, I want to go back to Councilman Lindley on the fact of when you see cost savings, how does the community, the city, how do we share in that? Because we spend a lot of money, our fire department spends a lot of money responding to things. The public, when an ambulance is called, spend a lot of money on an ambulance ride. How do we see that? Will ambulance costs come down? How will we see some cost savings, and how will those cost savings be passed around? And you don't have to do this tonight. I would just like it a part of the conversation as we go forward.
Absolutely.
Because I would like it to come back to us to show us some cost savings, how we help the public, how we help the ambulance service, but how we help the fire department and our budget constraints.
Yeah, so I can't, obviously, it's not something that's live here, and I can't give you actual concrete data. What I can tell you is that we've done a study of the overall cost savings to one of our programs. That would be the Seattle, Washington program. Seattle, Washington was an early adopter, and in their first 3 years, they navigated almost 21,000 patients to nurse navigation. What we were able to work with them and determine is that over that time, while there's not it's a hard thing to quantify, but there was a cost avoidance, really, and that's where the savings came down, is there was a cost avoidance on the part of the community and on behalf of the healthcare system. There's a cost avoidance of those patients who couldn't cover the cost of the services that they were being given. And what they came up with was in the first 3 years, they've saved roughly $19 million. Now, obviously, 20,000 patients in 3 years, that's a lot because they're a much larger area. But we are able to attach some sort of value in cost avoidance to that. Based on our rough numbers here, once you're at full maturity, that cost avoidance would probably be in the realm of close to $1 million a year, but that's a cost avoidance. It's not really a savings, and that's a hard thing to quantify, but that is what our first estimates would give you.
I would like it to be put into the overall proposal so the public also understands what would happen. My biggest concern is when we did the crisis center and we went out and sold it to the voters, that it would save a lot of money for the hospitals, and it would save the community and things like that. What happened was, as soon as the mill levy passed and people were paying for it, the director dropped the it was a three-legged stool with the community, well, actually a four-legged stool. The community, the state was putting in some money, and both hospitals, but both hospitals ended up getting reduced down. But the taxpayers are still paying the higher amount. So I have some concern, and that's why I always ask on if there's cost savings. Are they passed on to the folks? Are they passed on just to your company? Are they passed on to us? Or how do we do that? And I know tonight is just a matter of trying to go forward and feeling if we're willing to do it. I'm willing to go forward and take a look at it. I just want to make sure that's addressed in it. And I don't want to turn around and say, well, the ambulance riders are still paying high here, and we're still sending out this amount of fire trucks, and our men are out there, and women, and you guys are being able to see a cost savings. So I want to make it a win-win for everybody around.
Understood.
Thank you.
Go ahead, Mr. O'Donnell.
Thank you. How many cities do you, or municipalities, I should say, do you work with now?
Individual municipalities or program sites. If you look at the map, some of our program sites encompass multiple municipalities. So for instance, if you look on there, Riverside, California, Riverside, that's a county, that's a large county. It goes from the border of Orange County all the way to the Arizona border, multiple municipalities. But right now, program sites, I believe we're up to about 33 individual program sites with multiple municipalities in some of our program sites.
My question I was leading it up to was, have you lost any? And what type of dissatisfaction have you encountered with municipalities you're currently working with?
We have lost some, and that's been for various reasons. We've lost some because we've put them in areas where it just wasn't the right place for it. The more rural you get, the less likely you are to see a nurse navigation program be successful. And that's really a byproduct of the personality of people who live in the rurals. I've lived in the rurals, and when I live far away from resources, I'm not going to call for anything because that's just not really who you are, right? Whereas the higher population areas tend to have a higher percentage of low acuity calls. So we've lost some because they just weren't being used. And the municipality said, listen, this is great. We like this, but we're not using it and we're not going to do it anymore. Mm-hmm. There were others where it was part of a 911 contract that AMR had, and AMR lost that 911 contract via the RFP process. And because of that, it was not included in moving forward. And so we then would shut down a program.
Thank you. You mentioned about people who are certified EMS, that their satisfaction level is higher because they were able to use it for the things they were trained on. And so that is reflected in retention program. It's the same, you find the same for the 911 operators, that the burden is less on them and they have more resources, so therefore the turnover is going to be less on them?
I think if we were able to survey them, we would find that. We don't. Right now, what we do is we're surveying our field staff, the ones who are responding to the calls. And that's something that we can quantify, is we can look and say that internally, where a GMR employee is, and there's also a nurse navigation site, roughly 12% higher job satisfaction. That's something I can quantify. I can't go out to, for instance, as a private company, I couldn't go out and start surveying a bunch of public employees from PSAPs and say, hey, how do you feel about this? It's just not something that we have a mechanism built in to do. What I can say is that what we have seen is that it reduces the time on task for the dispatchers, because if they're dispatching a call, they're dispatching apparatus to it, but it's always something that they're keeping track of. It's always something that's on their board. What's the status? How long has it been? It's something that, even if it's not a physical task, it's still a mental task. It's something that they have to keep on top of. And by reducing that, it's going to reduce their mental wear and tear and their time on task for those. Yes.
Thank you.
All right, I think Mr. Neese has a final question.
No question, Mayor. I'm actually ready to move to a motion to direct staff to move forward after public comment.
Yeah. So that's good, though. Anybody else? Nice job. Had all the answers. Way to go. Thanks.
Thank you so much.
I'm going to open this meeting up to public comment on this item. If there's any public comment, we'd sure love to hear it, so come on forward. But seeing none, the question before us is do we direct staff to begin the formal process of integrating, or do we not direct staff? I think Councilman Neese would like to see us direct. And I see a whole lot of head shaking, so you have your direction, Chief.
Mayor?
Yes, sir.
I think what Councilmember Kennedy said about making sure we have liability issues, cost, reports, and maybe reporting back to us periodically through the rollout to council would be very helpful, and also to the public to educate that this plan is coming. So that would be part of the direction that I was going to make.
Good note.
I appreciate your consideration tonight, and I just wanted to close with all of you to note I want to guarantee you as a fire chief that I don't take this lightly. We will continue to build a very robust protocol system. We do it every day. So as we work through this, we just want to get the appropriate care that is needed. I don't know how many have been to an ER, got treatment and left, and you didn't feel any better than when you got there. So getting the right treatment and long-term taking care of people is our goal here. I understand the financial concerns, and I appreciate all of your input on this, and I will take that with me as we build this out. So thank you. I appreciate it.
Great point. All right, ladies and gentlemen, it's 7 p.m. and looks like we may have more than 30 minutes for item 3. Would you like to take your break now? All right, we'll take a 10-minute break. All right, since we're all back, we'll move on to item number 3, Opportunity Zones 2.0.
All right. Good evening, Mayor and Council. I'm here to present an opportunity for you. Oh man, it's good. That was unintentional pun there. So these were originally established in 2017. They were supposed to be a one-time thing for 10 years. Part of the One Big Beautiful Bill Act. When was that approved? 2025, I believe. They made these a permanent function, but they still only last for 10 years at a time. The idea, an opportunity zone, is a census tract that has been identified as eligible and then nominated by state governors to be determined as an opportunity zone. What that does is it creates a federal income tax incentive for capital investment in that area. So there's no property tax, there's no impact to the city of Billings directly. There's indirect benefit in that you likely would see concentrated development in this area, increase in tax base, and again, only investments in that specific census tract that are nominated by a governor are eligible to benefit from this. So we're coming up on the end of our 10 years, and the federal government has identified 8 census tracts in Billings that are eligible to be nominated and approved by Governor Gianforte. There are 58 tracts in all of Montana. He is going to nominate 25. That's the limit that he can nominate. And just last Monday, the state of Montana sent out what their process will be for determining those 25. So I guess I've got a slide on that in a minute. But these are the 8 census tracts that either met the median family income or poverty level thresholds in Billings. And as far as I'm aware, there are no other census tracts in Yellowstone County that qualify. If you want to look at all of the census tracts in the United States, I have the website up there, hud.gov/opportunity-zones. Okay, so applications are due July 7th to the Department of Commerce. They will rank them and make a recommendation to the governor, who will make final selection in September, and they will push that information to the Department of Treasury, who will then certify opportunity zones later this year. The state of Montana is requiring that we fill out 1 application per census tract. We may submit multiple applications, but if we do that, we need to prioritize them. We had a call last week with the Department of Commerce. I guess I took a few notes from that, and the things that I think they're going to be looking for are the number of partners that are going to collaborate on these applications. The eligible partners are cities, counties, towns, economic development agencies in the area. They're looking for areas that are ripe for development and ability to demonstrate movement in the short term. So when you're thinking about this is a 10-year designation. It's not, it's not a 20-year redevelopment plan. It's a relatively short window when you're looking for large capital investment in an area. So you should be thinking about areas that land acquisition could occur or maybe already exists, sites that are ready for development. That's kind of areas I think that you're going to see more investment in a short 10-year period. I've highlighted the 4 areas there of the application that they're focusing on, and we'll, depending on what you guys come up with tonight, we'll gather everything we can to support the census tracts that are recommended. The city doesn't have to be the applicant. It could be any eligible partner, which again is a county, Big Sky Economic Development, Beartooth RC&D. Those would be eligible entities to apply. I spoke with Besida, Beartooth RC&D, our urban renewal districts, and At this point, I believe the city is, well, depending on our conversation tonight, but the plan is the city would be the lead partner on the application, and then with all of these partners collaborating on it as well. So with that in mind, I have really, I guess, 3 questions. Do you want to submit an application on any of these census tracts? If so, which one or ones? And if there are more than one, what would your priority be? I would encourage you, certainly we can submit 8 applications. I think that would be a waste of everyone's time, and you're not likely to get 8 designations. I think you're probably likely to get somewhere between 1 and 3 designations. You know, if you look at the state, 8 out of 58, that should be on. If we get our allocation perfectly, it'd be 3. I get the feeling there may be more focus on rural areas. So, you know, I don't have high expectations we'll get 3 census tracts nominated, but that's kind of where I'm gonna leave that. I got a couple other comments, and then I'll turn it over to you, Mayor. We do have Bill Honeker's here to talk about his development downtown. He has used the current opportunity zone. So if you have questions about how that works, he's prepared to talk about it in great detail. You may consider having public comment at some point during your discussion rather than at the very end. The last thing, I did want to go back to this. So the one that's 4.02, you can barely see it, but there are hash marks in there. That's the downtown hospital corridor. You guys are all familiar with the map of Billings. That is our current opportunity zone census tract. We don't have any other ones in Yellowstone County. So just so you're aware, that's why that one is hashed out. If you've got really good eyes, you can see that. And Mayor, I'll turn it over to you if there are any questions, and then we can go through whatever process you'd like.
Thank you, Mr. Zoller.
Mm-hmm.
We're going to start with Mr. Kennedy. Mr. Kennedy.
Does it have particulars on how big that opportunity zone can be?
So the application will be for a census tract, and you can only submit 1 application per census tract.
Okay, and I'm just going to throw out my 2 cents worth in. I would like it to at least encompass 27th Street corridor, and to be able to, especially on the south side, go as far over as the refinery, and then into the triangular area along 27th Street, because that, and I'm not sure if that encompasses both 4.02 and 4.01, but that area I'd like to see at least we're in the running for that.
I'm actually going to get out of the slideshow and go to that website, because I think we can zoom in a lot more and see specific areas, but please continue.
Go ahead. Well, you're be 5th then, Mr. Espenlater. We'll wait your turn. So go ahead, Mr. Zeller.
Well, so Councilmember Kennedy, I believe largely what you were talking about is Census Tract 3, which the dividing line is essentially the railroad and then State Avenue, and then, well, I guess I'd call that the river there. So that would include P66, the Southside Triangle, and South 27th Street, but it would not include anything north of the tracks. It would be kind of, well, I can't. It would be this census tract number 3 right there, which the borders are easier to see here.
Then does 4.2 then, does that, or is it 4.1 take in the north section of 27th?
The north section of 27th would be on 4.02 and on 2.
Okay.
Yeah.
Right, thank you.
Yep.
All right, so we have 5 people in line. We'll start with Mr. O'Donnell, then we'll go to Mr. Boyette.
Thank you. I'm interested in the size. It would seem to me that there is a threshold under which the use of this program would not make any financial sense. So is there such a threshold, or maybe Mr. Honecker would be more advised about that?
Yeah, I think perhaps Mr. Honecker would be more knowledgeable on that, although I would say that small commercial development, while it would be eligible, likely wouldn't make sense. I think you're going to have a lot of compliance related items if you were to file for this, meaning attorneys and accountants, that a small project isn't going to be worth it. You're going to need large commercial investment for it to actually make sense.
Yeah, that's why I was thinking like Census Tract 11 really wouldn't. I can't imagine any large enough project in that area, or 10. One of the representatives from the Heights is always pitching for them, so I imagine that they would want to have more economic development there. But it looks like a 402, 3, and 7.06 would be the ones that have the greatest benefit to the city.
I think that's probably a fair statement. I would assume areas that are largely residential concentration, outside of a large apartment building, you're just not going to see big commercial development there. So that's my thoughts.
All right, Mr. Boyette, then Ms. Shaw.
So Andy, you said this one has a 10-year life that's already there. How many times has it been used during that 10 years?
Because it's a federal income tax designation, we wouldn't have any idea. I'm only aware of Mr. Honecker since he shared that with me. But yeah, I would purely be speculating if I were to answer that.
So we don't know if
they only report on your federal income tax, so we don't have that information.
All right. CM Shaw, then CM Nicholson.
Thanks. I guess I want to make a pitch for parcel 2. That's the eBird area. I think when you on your list talking about land acquisition, that is an area where there's plenty of vacant land that could be acquired and would be, in my mind, ripe for commercial development. Also has the benefit of adding to the TIF increment, hopefully, which would be very helpful in that area. Anyway, I'm curious what your thoughts are on that, because I also agree with Councilmember Kennedy. I'd love to see the South 27th Street in there. My concern is, I hear all the time from people in the South Side Triangle where so many people are renters and they don't want to be pushed out of their houses because a bunch of development comes in and prices them out. And so that would be my concern with including that tract. But what are your thoughts on that, Andy, of that and parcel number 2?
Yeah, I think you make some good points that certainly would make that parcel or Census Tract 2 very desirable. One of the things the Department of Commerce commented on is projects that have community support. So they used an example in San Francisco where they were moving forward on an opportunity zone project, which was ultimately going to demolish some small older homes and put in a big high-rise apartment building that didn't have much community support. And so they want to avoid anything like that. They don't want negative connotations with this. And then projects that would improve number of jobs and potentially some level of manufacturing, whatever that might look like. As they were talking about that, I was thinking about kind of the eBird downtown area as the potential places where that might fit pretty well. But so I think we can make a strong case for those.
Okay, that's helpful. Yeah. I think I mean personally, I'm that was the one that jumped out at me, and I could see a lack of community support with parcel 3 in the triangle, not along South 27th, but people being concerned about somebody coming in and trying to buy up a couple houses and really changing the neighborhood.
All right, CM Nicholson and then CM Aspen later.
It's interesting what you learn when you start looking up the stuff here. It's like I live in 4.01, which turns out to be the area that has the highest poverty rate. I don't think I'm contributing to that. It's 27%. Yeah, it's the second lowest median income of all these areas, and at $47,000. But I don't think that's the best place to do this. I think I agree with Councilmember Kennedy about 3, with the caveats we've already heard. That has the lowest median family income at just under $37,000, substantially lower than anywhere else. And the poverty rate there is over 26%. There are areas that I think could accommodate some improvements there along South 27th. We've already mentioned the eBird, and I think that's a great place because it has land that could stand some big developments. Its poverty rate is 26.8%. So I like the eBird for this. That would be area 2. And then area 7.06 is its poverty rate is 21.39%. It has the highest median family income, but it's the part of the Heights that's in Ward 1, so I would support that.
More beating heart stuff. Councilmember Aspenlander.
Yeah, to me, the two logical are 4.02, probably keeping it where it is. That makes the most sense. And then Census Tract 3. The reality with Census Tract 2 is that that's just not we're not seeing businesses move there. And I think we also have to be realistic about what this actually is going to do. This isn't all of a sudden going to just make people drop a bunch of money and invest and build all kinds of stuff. I mean, they've been around for a while and it just has never worked that way. So we got to be realistic about our expectations, and Census Tract 2, the eBird is just not that attractive of a place to be investing a lot of money. 7.0, the Heights tract, again, there's nothing there that you can consolidate to do anything of any magnitude or size. There's nothing. So, I mean, I think there's a couple sites in the downtown and there's a couple sites down in 3, and those make the most sense.
Thank you. Let's see, Mr. Neese.
Okay, you guys. No, Andy, just a real quick, on these, sorry, we can't control, if you say you go to Opportunity Zone 3, you can't control where an investor is going to, they just do it wherever they've done it, because it never comes back to city council, right?
Yeah,
and so they could wipe out a neighborhood of houses, drive up the rents in that area, and then all those people are displaced. I mean,
I think hypothetically that's
and I think it's
true.
happened around some of the cities that have done large developments like that.
But yeah.
And so I'm concerned about including 3 in there because of that. And then one more question on this is it limited to just commercial businesses, housing? It doesn't matter what the development is.
So it would be effectively what you're doing is you're investing your unrealized capital gains, holding them in the location for 10 years, and then getting them out tax-free. So in order to invest in that, I believe it has to be into a profit project. So it's not going to be residential development unless they're all rentals. And It's not going to be homes that we turn around and then sell for.
So it wouldn't be like condos or anything like that because you're selling them right away and you're taking your profit right then. Okay.
Right. I would imagine if you're going to hold them as rentals, though, it would be eligible.
Okay. So then what about, Ebert has a lot of properties that have environmental issues. They're brown sites, lots of brown sites there. And so they can't develop a lot of stuff. So would that qualify, or would that be, maybe Councilmember Aspelander can help me on this better, but would that help get some of that return because they're having to pay kind of deep discounts on this? They clean it all up and that's part of their cost and they get that whatever capital gain they have after cleaning it up back. Is that
I'd be speculating too much to give you a good answer.
That's one of the reasons I think Ebert would maybe, if that would be a positive help to get rid of some of those brown sites, because they've got a lot there. And to Councilmember Aspenliner's point, I believe there is a lot of good spots in the Heights. As I look through, there's lots of spots, lots of open acreage between Main Street and the Heights that are just vacant land, ready to be opportunity zones. And so I would say 706.
Okay,
what I'm
check mark by
voting for.
706.
I just look at Google Maps, it says it right there.
Okay, any other questions for Andy? All right, let's hear from the public regarding Opportunity Zones 2.0. Hello, Mr. Public. Very good.
Just in case you have to do that, because you'd think I'd know that being here as many times as I have been. But so we have the only that I'm aware of, we're utilizing the OZ, the Opportunity Zone program, with our project that we're building in the AC Marriott, and I believe we're one of 5 other projects that have used it in the state. So although that seems like it's underutilized, and I would agree it is, the reality is it's, like every complicated IRS program, it took years to actually figure it out and for them to figure it out. And so it really wasn't used by the developer investor community until recently. And so that's why there was a lot of pressure to create a new law where they're permanent, which is important. Because you don't have to go through this process in terms of approving the opportunity zone. You just have to redesignate the ones every 10 years that are important to a community. And, the program is not, even though it's a complicated IRS program, the reality is it's a very simple process. From an investor point of view, you sell your asset, and in this case, it can be a piece of real estate, it can be stock, it can be your business, it can be anything that creates a capital gain. And so you create that capital gain or your profit, right? And then you create an opportunity fund that is your own opportunity fund that then you deposit this profit into. And at that point, you can invest into an opportunity zone business, an OZB. And in this case, that's what we're doing with the AC, because we happen to be in the opportunity zone, the only one that exists. But the program, it's misconception. The program doesn't benefit the project directly. But what it does do is it provides, a significant tax incentive for an investor, but only if they keep it for 10 years. So what we're finding is that, that's a long-term investment for a lot of people. And so what we're finding is that it's attracting the local investor because they know the property, typically, they know the developer and or the partners, they know the business, whatever it is. And whereas when you have an out-of-market investor, a lot of times they're looking to come in, develop, flip, get out. So this project is specifically, from my perspective, a community project in that it attracts long-term cash. And that's, I think, for a community is really important. So in our case, we have, which kind of even surprised me, sorry, I've never done anything in 3 minutes, so just for the record. In our case, we have 70 to 80% of our investors are utilizing the program, including the principals. And just a point, even though it's, it's maybe an opportunity zone business, you don't have to invest with an opportunity fund. A regular investor can come in, pay cash for their interest, and it's just a typical investment. But for some, it provides them kind of that extra incentive. It puts them over the top in terms of investing. And we actually have 2 investors that are selling assets they've held for a very long time, specifically to get into this program. So I know in that case, it made a big difference. And I think that's true generally with other projects too. I can't tell you of the other 70 or 80%, but I know those 2 have done it specifically for that reason. So when you're deciding, and Andy brought some of this up, but when you're deciding, what tracks, I think it's important, that the very first question is going to be, has the track been selected before? And if so, have they utilized it, right? And so we don't have, even the state doesn't have a plethora of projects, but I do think, we're in the one downtown, and we're contributing a $50+ million project. So I think that will be significant in terms of their adjudication of it. The other thing it'll, and this came up here a little bit earlier, but the one thing they'll be looking for is there enough available project or land and parcels and businesses, whatever it is, in a tract to convince a developer to develop them relatively short term. And so what happens is, when you look at a lot of these other tracts, and I appreciate your comment about poverty rate for certain. It's important, but it's not necessarily important to this. What's important is that you have projects that they're capable of building relatively short term. So when you look at and I would also like the South Side from the extent for that, all those reasons. But if you look at a lot of the tracts, a lot of the available projects or parcels are on the major arterials. So in the South Side, for example, it's First Avenue South and South 27th. And the rest of it's pretty much residential, and you're not gonna attract an investor in other words, there's not that big of a significant difference to convince you to go in and buy a whole neighborhood, knock it down, and build a whole new thing. There has to be a profit motive to that. So for me, it's, I look at, obviously I have an affinity to downtown, and I've spent most of my career there. So it's probably not any surprise that that's where I'd love you to focus. But I also think that eBird possesses all the attributes of available parcels. I think it's important that a community shows that they want development in a certain area. So is there a TIF project, or is there a TIF increment program there, or is it in the works? Are there parcels in your track that could apply for new market tax credits? I mean, any of those things are going to put a higher priority because they're more likely to get developed. So for me, obviously, I think the downtown tract is important, and all it takes is looking at all the available property between our site and the hospital, and I think that's pretty obvious that that's significant property to develop. But I also think the bird has the same attributes. And even though there isn't much that has happened there, that's the whole kind of purpose of this project. And one will happen before the other for certain. And we have to fill up some of the downtown TIF, the 4.02, and then it will filter over. And so if in my eyes, in terms of ranking, it would be downtown, it would be 2, and then if I were to pick one, it would be 3, the south side, only because there are parcels there, and I think they're in the biggest need for development there. But I also think you're going to have to. The program was originally designed for rural tracts, and so the rural tracts are going to get the highest priority. So the idea of us getting 8 is not a reality, in my opinion. But I think we're likely to get 1 and maybe 2, just like we did last time. We got 1. So I think it's really important for you to pick the right ones that are ready now. And I'm not saying the other ones won't be in the future, but they may not be as ready as others. And so that's kind of my 2 cents worth. And I'm as always available for questions.
Thank you. And council, my apologies for granting Mr. Honaker the extra minutes, but he's one of 5 boots on the ground experts in the state. So I thought it was important that we hear from him. And so along those lines, are there any questions for Mr. Honaker? Mr. O'Donnell?
Bill, you mentioned that there are a few others that you're aware of who have taken advantage of this program around the state. What type of projects are those?
You know, I wouldn't have the intimate knowledge for that.
Are they apartments or are they?
A lot of times they're rural, and the rural part of this has different rules than the small urban areas. And so I'm just intimate with the urban, you know, for obvious reasons. But so I couldn't really answer that in earnest.
Thank you.
CM Pittman?
So saying something nice about the Heights would be beneficial.
Well, the Heights is the same thing, though. It
Right.
has one
No,
main artery, or maybe probably 2.
Right.
And that I think, you know, I just don't know if it's ready. And they're hard. The big parcels are important in this because it has a bigger effect.
Sure. So just to follow up, so 4.02, I think, is obvious that we need to keep that. Were you saying 3 was your second?
No,
Or-
2 with the bird. 2 would be my second.
Okay.
In my opinion, but of course, but you know, and keep in mind that in 4.02, you know, the hospital's in that too, and even though, you know, they're almost $1 billion project, probably wasn't able to use that because it's a nonprofit, et cetera, but all the peripheral projects that come out of their investment, which probably would be able to use it, and I think that's also significant for that track. But
CM Shaw?
Yeah.
Please rescue us from this argument.
I really appreciate your analysis, and I personally agree with your rankings of, I think 4.02, number 2, and then number 3 would be my preference as well in terms of priorities. But just so you know, all 3 of those are in TIF districts, which is, I think, great. Hopefully that will help elevate our chances. And I guess I just wanted to clarify, do you think 2 jumps ahead for you because of all of the vacant parcels that are there? There's just so much, I think, that's available.
Yeah, it's just more ready.
Yeah, okay.
You know, it has the TIF, it is part of the new market tax credit pieces. You know, there are things happening there. There are a couple, you know, not the kind of projects that this probably needs. And whoever asked the question, there is just a assumed minimum size of a project because, you know, in our case, you know, it's probably $50,000 or $60,000 just for the legal and accounting advice. So, you know, doing it with $1 million project, just, you know, for the tax savings is just not going to make sense. So it's probably 5+ before it starts to make sense.
Okay. Yeah, I mean, I want the city to have the best shot at getting 2 or maybe 3, but hopefully 2, you know, at least 1, but hopefully 2. And so I think we've got to be really careful about what we prioritize as second, because I think you're right. We're unlikely to get 3, in my opinion. So I just wanted to hear your take on that again. So I appreciate that.
I said this to Andy a couple days ago, but I was like, well, you know, you can always ask for more. And you know, because it doesn't really cost you anything. And then I realized, oh yeah, he's the one doing it. It probably
right.
isn't the smartest thing to do.
I don't want him to have to write 8 different reports.
Yeah, right.
So
I don't think that would make sense.
I think 3 is reasonable.
Yeah.
I appreciate that. Thank you.
All right. Thank you, Mr. Honaker.
All right, thank you.
All right. Further public comment will be limited to 3 minutes. Is there any further public 3-minute comments? All right, seeing none, we'll close that part. I do have one question for Andy. You had, in an early meeting today, you had indicated that you'd be willing to do 100 applications, but you prefer no more than 3?
I think that's a direct quote, Mayor. Yes.
Yeah.
Yeah.
Okay, thanks. So discussion with the council, Mr. Boyette?
Well, I think because once we do this, we're never seated again anyway. I would like to make a motion to direct staff to look at 4.02, number 2 and number 3, 3 in a row and take our best shot. And hopefully we get 1 or 2 of them anyway.
Can we come to some sort of consensus on that? We okay with that?
Second that, if they're in that order.
Okay, 402, 2 and 3, bunch of nodding heads here. Okay.
Okay, I
There
got
we
it.
go. Thank you, Andy.
Thank you.
Oh, and, item number 4. City Administrator job description, review, and recruiter selection. Is there anything special we want to talk about before we get started? Mr. Aspenleiter?
Yeah, thanks, Mr. Mayor. One of the things I think I'd like to do, and we talked about this a little bit as we started this process. I'd like to push the recruitment back, kicking off an executive recruiter back 60 days, and let us get stabilized, continue to stabilize here, continue to work through some of these things, and work with our interim city administrator and push this selection of the executive search off 60 days and come back and revisit it at that point in time and let us kind of work through this process. I think it's important that we get the job description right and get that done tonight, but I'd ask us to kick this recruiter can down 60 days and let us continue to work through the setup that we have right now.
Well, let's talk that through a little bit. Any discussion regarding that? Mr. Boyette?
I guess I think it's a great idea, but the one thing is, how are we going to evaluate the process that our new interim city administrator is working? Is there a way that we can judge the work that's being done or not being done? How do we, in 60 days, we come back and what have we learned? I mean, how do we learn from what we've spent 2 months on? I mean, we have to have a way of evaluating what we're doing.
So you got an idea there, Ms. Stanton? I know we're putting you on the spot here, but
I mean, I would agree that mayor and city council that might be a short time frame. Councilmember Aspenleiter to look at that. Oh, can you hear me? Sorry. Better? Okay. That might be a short time frame to evaluate that. Keep in mind that when we do this process, once we hire somebody, it is a 12 to 14 week process if you choose to go that direction. I am all for holding off on that. I don't know how candid I can be tonight, but I really believe our candidate is sitting right there. I truly believe that he has and will do an exceptional job. So I am okay with us holding that off and evaluating that. We've done a lot of these national searches in my career here. We hire recruiters and we do these national searches, and who really responds to our city of Billings recruitment are people that are from much smaller cities. They're 6,500, 7,000, 10,000, nothing against that, but it's a big jump to our size of city. And so we bring these people in from all over the country, and they really have no idea what the job really involves. So in all candidness, I wouldn't mind holding off on it as well, and evaluating what we have here, and I don't think you'd be disappointed.
Could you do a matrix for us to complete, or could you guide us through a process of making a decision after a couple months?
Sure.
Okay.
Yeah.
And to be clear, like I just picked 60 days out of the blue. If 60 days is 90 days, that's fine. Like I'm open to those things. What I don't want this to be is, 6 months, 9 months down the road. Like we know each other well enough
And
to,
I agree.
to make a decision
I absolutely
in a
agree.
reasonable period of time.
The problem with that too is the job is too big for Kevin Iflin to do it by himself. Even with 3 people that have full-time jobs, we need an assistant. He has to have an assistant. So it wouldn't be fair to Kevin as well to draw this process on. He definitely needs some help. Even though we have 3 people that have graciously stepped in, they have full-time jobs as well. So we can't draw it out for 120 days because he's going to need help, some full-time help.
Let's see, Mr. O'Donnell, then Mr. Kennedy. Fine, Mr. Kennedy?
I think that would give us an opportunity to evaluate. We have been with a public works director and we went nationwide and all of that, and it hasn't worked out too well. I think we have an opportunity to even recruit local. So I think I like the idea of holding off. I like the idea of looking to see with Kevin and who else in this community may be interested, and then coming back and coming up with a game plan, maybe saving a few bucks instead of going nationwide or Northwest wide or whatever, and seeing if we can get some folks that may be interested. I think the other piece is that we put together fairly quickly, not tonight, but fairly quickly, council's recommendations to the job description and incorporate those and see how they mesh, and have a couple meetings that we can talk about the different things in that job description and move forward. So I think what you do is give us a little bit of breathing room and be able to move it forward and really get a feel of where we've been, because the only thing we've really done so far is we have Kevin that took over as the interim, and now is the time for us to start laying the groundwork.
Yes, and I'm not sure if all of you saw that Councilmember Neese sent an email out today. We had kind of worked on it a little bit on that job description, and so we do have some input there. I don't know if everyone had a chance to review that. We did make some changes to that description, so at least it's a start. And really, in all reality, when you look at evaluating Kevin in 90 days or whatever that is, you'll use that job description, right? That's how you base that. That's what we base the job posting on, as well as interview questions and really performance evaluations. So, sorry, I am cutting in and out. I'm not sure. So it's really critical that we get that right, for sure. The job description is really critical to the entire process.
Okay, this is kind of sudden, so I want everybody to get an opportunity to speak on this. In this line, this order now, we have Mr. Neese, then Ms. Shaw, then Mr. Pittman. We'll put Councilmember Nicholson on there too. Ms. Aguirre, Mr. O'Donnell. So, and Mr. Lindley. So, Mr. Neese.
Yeah, I thought we were going to switch orders and talk about the job description first, and that's really what I wanted to move into. This whole other process, I think it can wait until we get the job description. So, I mean, if you'd like, I'd like to hold on this conversation, move into job description, and get that worked on.
Let's let everybody talk to this, and then we can jump into the job description. Probably won't take too much longer. So we have Ms. Shaw.
Thank you. I think 90 days, I don't know, that's striking me as a good amount of time, get us through the summer. It's a little bit of a runway. I like pushing it. I think it makes sense. I actually disagree with Councilmember Nice. I don't want to go through this and have us try and amend this on the fly with ideas tonight when we don't have anything in writing in front of us of changes that should be approved or not. So I understand, yes, we need to finalize this, and I think you're exactly right, if this is the template we would use to evaluate Kevin in 90 days. But I guess I would ask for maybe a form or something that we are all contributing to, that we can all see recommended comments or different things, so where we can have that conversation versus like, I want to change this word, and that can take us absolutely forever.
All right, thank you, Mr. Pittman.
Sorry, okay, the light's on. So yeah, I'm all in favor of delaying the national search. I think nailing down the job description is priority. And then I think it might even benefit us to then go locally, just post as a vacancy and see who applies and where we're at within that period as well. I mean, we don't have to wait for one thing to end to start another. We can open this up and say, we're looking for a city administrator. Here's the job description, and then have people give us some feedback. The one thing I would like to say though is whenever there's an opportunity to look at how to restructure an organization, I think it's an important time for us to do that. I mentioned to Kevin earlier tonight that seeing how this works, having one city administrator and 3 part-time people, maybe it works, maybe it doesn't, but this is one of those few chances where we actually get to see see how this works, or if it's not feasible.
Yeah, I know I was in Kevin's office today, and he's got his whiteboard. You probably saw it too. And, you know, the 3 have all these assignments, and he has about 5 or 6 other assignments that he still needs to reassign. So I think it would be hard to do that on a part-time basis. I truly believe that. I really believe you need somebody in that role full-time.
Thank you. Dr. Nicholson.
Yeah, I agree with all the reasons to give us some time to do this, but we're coming on summer. A lot of people are going to be gone. I think we need to take that into account, and fall would be a better time to get after this.
Thank you. Ms. Aguirre.
I would agree that 90 days is a reasonable target to give everybody some time to get the information that they're looking for. In terms of parsing the job description out tonight, I'm not in favor of that. I think it's fine the way it is.
Thank you. Excuse me, I have a frog in my throat. Councilmember O'Donnell.
Thank you. Is it extraordinary for the city to get uninvited applications? Somebody from another city, for instance, who has equivalent experience, not just a 10,000 population town, but equivalent experience or more, who had just they want to spend the last 5 years doing what they enjoy doing. They want to have a smaller location, and they want to move to Montana.
That has been really unusual.
Yes.
Yeah. We don't see that. You would think that would happen, that people, Montana's become very popular, right?
Yeah.
But we have not seen people necessarily just want to move here and, finish out their career. That come from larger areas and come to a smaller area.
It's just one thing. If that should happen, would the council be in a position to simply hire that person, or do we have to go through the competitive process and all that stuff?
Oh, yeah, absolutely. You would have to go through a competitive process.
Okay, thank you.
All right, Mr. Lindley, then Mr. Aspenleiter.
Thanks, Mayor. Well, I just wanted to start by saying that I think, to me, it's been very clear in just a few weeks that we're in very good hands with Mr. Ifland. So thanks for the hard work. I'm sure you were working a lot of hours before, and I'm also sure that it's gone up. I also think that the 3 people that are assisting have done fantastic work. And I tend to agree with Councilmember Pittman. Whether or not it would work long-term, I don't know, but I like seeing more people that have already invested a lot in the city have an opportunity. So I think that's fantastic. So I would be more of a proponent, I think, of 90 days just from a standpoint of, getting a little runway out there. And I think the comment about the summer makes sense too.
Thank you. Mr. Aspenleiter.
This is where I'm gonna push a little bit. We got sent the job description at least a month ago. And it's been on this agenda since it got posted. So I don't know what we were gonna do if we weren't gonna talk about the job description. And we've all had the opportunity to look at the job description with the understanding that if we had comments, we needed to get comments in. So at some point, we got to do that. And if we're going to use that as the tool to evaluate in 60 days or 90 days, we can't kick that down the road until we're halfway done and then say, hey, okay, now we're ready to talk about this. Like we got to get it done sometime. And so when? If we don't do it tonight, then when? I think Councilman Neese has done a really good job of starting that. He sent his comments out to everybody. Everybody had a chance to look at those and to talk through that. Mr. Councilman Boyette has got some comments. I think if we're not going to do it tonight, I want to know when we're going to do it and when this month it's going to get done, because we can't kick this down into July, August, and then we're going to make a decision in September if we go 90 days. So there has to be some urgency and some commitment to getting this done if we're going to do it in 90 days. I'd prefer to get it done in 60 days because the longer we delay, the longer we delay.
Agreed. Mr. Boyette.
So I would make a recommendation that the operations committee do this right away.
That's what I was thinking.
We can meet
Yeah.
this week, next week at the latest. But the thing is, if anybody has any issues, put it on a piece of paper and send it to the operations committee and we'll take care of it and then we'll bring it back right away and be done.
That sound good? All right, so let's do that. Can we schedule a week from Monday?
Sure.
Ops meeting a week from Monday?
Yeah, I should be here.
Okay. Let's do that. Yeah, a week from this coming Monday. We can do it next Monday. Yeah. Next Monday, that's quicker, but sure. All right. Do we have time for?
Just so I'm clear, on the 22nd, that's when you guys want to have that operations meeting?
Yeah.
Okay. I'll make sure Juliet gets that information.
Okay.
And Mayor?
Yes, sir, Mr. Neese.
I'm not opposed to waiting 60 days. 90 days, I think, is too long because you look in July, August, now you're into September.
Yep.
So I think we should shoot for 60 days.
All right, so it looks like our instructions to staff are going to be to wait. Oh, we do have to have public comment. Okay, well then we'll open this up to public comment. Thank you, Mr. Boyette. Anybody out there? The 11. Yeah. Okay, so no public comment on this particular item. So it looks like our instructions to staff regarding recruitment is to delay. And I think I see a consensus of 60 days. Or long. Who wants 60 days? 1, 2, 3, 4, 5, 6. Who wants 90? 1, 2, 3. So we're going to wait 60 days. We are also regarding the job descriptions. Send emails to the 3 members of the operations committee. That'd be Mr. Yeah. And we will conglomerate those and bring back a recommendation Monday at 11. Okay. All right. Oh, and by the way, Mr. Ifland, you are doing a great job. And your three assistants are doing a great job too. I was looking for a different word, but I couldn't get it. All right. Thank you, Ms. Stanton.
Thank you. Have a good night.
This part of the agenda is a highlight of upcoming agenda items of council interest. That's you, Mr. Ifland.
So thanks, Mayor and Council. So June 22nd, regular meeting, there's basically several public hearings are scheduled, including the FY27 wholesale water and wastewater rates, right-of-way fees, T-bid assessments, and a bunch of develop-related hearings on that. And you will see the 21st Street underpass on the consent agenda that we talked about tonight, so keeping that in mind. July 6th work session, we've got some Met financials. We will be getting an update on the LB Lofts construction project. And then funding of South Park Pool, or some South Park Pool information that we discussed at an earlier meeting today. And don't forget, July 8th is a special work session on our DV series. That's all I have.
Thank you, sir. Council discussion is Mr. Kennedy.
We have a legislative meeting this week at 4 o'clock. And it will be, and we have asked before for any legislative priorities for council people. So if you have a legislative priority, and Jessica has sent out to department heads and to each of you. So if there are legislative priorities, please get it back to the committee, because the committee will be meeting at 4 o'clock. We'll look through those legislative priorities. We'll be talking with the lobbyist at that time. And then the last thing that we will discuss is the time for our legislative meetings. So if you have a certain time that you would like for legislative meetings, we're also looking at possibly doing a noon to 1:30 legislative meeting once a month that council people can come to. But if you don't get it into us, we can't do anything about it. So Jessica has been very good about getting that out. And please respond if it's something very desirable that you would like to see. And then next week, we're having a second meeting, and that will be on June 24th at 4 o'clock. So through the month of June, we will keep at the 4 o'clock, and we will have a special meeting, and we've invited legislators to be there at that meeting on their legislative agenda for the next session. Thank you.
So just to clarify, the legislative committee is meeting this Wednesday at 4 p.m. and then again next Wednesday at 4 p.m. Thank you. All right, now I will open it up, Mr. Kettleson, to public comment on non-agenda items. Oh, well, we'll miss you, Mr. Kettleson. Anyone else want to make a public comment on a non-agenda item? Seeing none, we will move on to adjournment. We are adjourned. Thanks, everybody.